Good morning, everyone. Welcome to the classroom of Kunming Preschool Education College. Today we will study Chapter 10, Mental State Assessment Part 1. I am your presenter, Tan Yukin. This chapter focuses on evaluating 3 fundamental orientation capacities in cognitive assessment. 1. Temporal orientation assessment. 2. Spatial orientation assessment. 3. Personal orientation assessment. We begin with the first component, temporal orientation assessment. Time orientation refers to the perception of time, such as determining the year, month, day, or week of the assessment, whether the assessment day belongs to the first half of the year or the second half of the year or the corresponding season, whether the assessment is conducted in the morning or afternoon or during the day or at night. Methods for assessing time orientation ability mainly include testing scales and interviews. The temporal orientation scoring criteria range from 4 clear temporal awareness to 0 no temporal awareness. During the assessment, the evaluator should employ appropriate respectful inquiries, such as, "Grandfather or grandmother, are you able to tell me what year it is? Might you inform me of today's specific month and date? Are you able to identify which day of the week it is today? Could you indicate what season we are presently experiencing? Would you be able to determine whether it is currently morning or afternoon?" Detailed grading criteria. 4 points. The assessed person has a clear sense of time. Main characteristics include able to accurately answer the year, month, day, or weekday corresponding to the assessment day, or the date answered is only 1 day different from the assessment day. It can accurately answer whether the day belongs to the first half or the second half of the year or the corresponding season, and can assess whether the day is morning or afternoon or day or night. 3 points. The subject's sense of time has weakened somewhat. The main manifestations include: if you cannot answer all the year, month, day, or week corresponding to the assessment day correctly, but the difference is 2 days or more. It can accurately answer whether the day is in the first half or the second half of the year or the corresponding season, and can assess whether the day is in the morning or afternoon or day or night. 2 points. The assessed individual has a poor sense of time. The main manifestations include: the year, month, and day of the assessment are unclear. It is possible to accurately determine whether it is the first half or the second half of the year or the corresponding season, and also to identify whether the assessment was conducted in the morning or afternoon or during the day or at night. 1 point. The person being evaluated has a very poor sense of time. The main manifestations include: they are unclear about the year, month, and day of the assessment, as well as whether the assessment day falls in the first half of the year, the second half of the year, or the corresponding season. However, they can identify whether the assessment was conducted in the morning or afternoon or during the day or at night. 0 points. The assessed individual lacks a sense of time. Main manifestations include: the year, month, and day of the assessment are unclear, as are whether the assessment day falls in the first half of the year, the second half of the year, or the corresponding season. It is also impossible to determine whether the assessment was conducted in the morning or afternoon or during the day or at night. Assessment considerations. 1. The assessor should inquire in detail about the subject's performance in terms of time orientation over the past week. If there is a discrepancy between this performance and the subject's performance on the day of the assessment, the performance that occurred more frequently should be used as the standard for assessing the subject's time orientation ability. 2. Assessors should allow the subject to answer questions verbally, by gesture or by writing, including Braille. The method of answering is not included in the assessment of time orientation ability. 3. When conducting a mental state assessment, assessors should also avoid using yes or no questions, such as "Is it afternoon?" to prevent the subject from guessing the answer. 4. When asking questions, assessors should use common words so that the assessed person can understand them correctly. If the assessed person has hearing impairment or weak comprehension, assessors should break down the questions as much as possible and adopt a step-by-step questioning approach to avoid multiple questions in one sentence. When answering questions, the assessed individuals may use either the Gregorian or lunar calendar. We now proceed to the second evaluative component, spatial orientation assessment. Spatial orientation refers to the perception of one's surrounding space. Assessment content includes whether the assessed individual can go out alone and whether they know the address information of their daily living location. Assessment methods, testing and interviews. The table shows the scoring criteria for spatial orientation ability. Polite phrases are commonly used by assessors. Grandpa, Grandma, have you gone out alone recently? Have you gotten lost recently? Do you know where you live? Grading criteria 1, 4 points. The subject of assessment is able to go out alone within the scope of daily life. The main manifestations include able to accurately answer the address information of their daily life location, province, city, county, / district, township, / street, village, / community residence, / building and floor and room number. Able to shop independently within their residential community. In the past month, 30 days. 2, 3 points. The person being assessed cannot go out alone, but can accurately know the address information of the place where he or she lives in his or her daily life. The main manifestations include they can accurately answer the address information of their daily life, location, province, city, county, / district, township, / street, village, / community residence, / building and floor and room number, occasionally get lost, and the frequency of getting lost is less than or equal to once per month. 3, 2 points. The person being assessed cannot go out alone but knows a lot of address information about their daily life. The main symptoms include being able to answer questions about the province, city, county, / district, township, / street and neighborhood name of their daily life location, but not knowing the specific building number and room number. And the frequency of getting lost being is less than or equal to once a week, but is greater than or equal to once a month. 4, 1 point. The person being assessed cannot go out alone, but has little knowledge of the address information of their residence or place of life. The main characteristics include being able to accurately answer limited questions about the address of their daily life, such as only knowing the province and city, and experiencing getting lost at least once a week. 5, 0 points. The person being assessed is unable to go out alone and has no sense of space. The main symptoms include being completely unable to answer questions about the address of their daily life and experiencing getting lost at least once a week. Summary 4 points. No missing persons within 30 days. 3 points. Is less than or equal to 1 time missing per month. 2 points. Going missing is less than or equal to once a week, but is greater than or equal to once a month. 1 point. Going missing is greater than or equal to once a week. 0 points. Missing at least once a week. Assessment considerations. 1. Ask the caregiver in detail about the subject's performance in spatial orientation in the past week. If the performance differs from the subject's performance on the day of the assessment, the subject's spatial orientation ability should be assessed based on the more frequent performance. 2. The ability to go out alone includes not only the ability to move outdoors but also the ability to move indoors. For example, if the person being assessed leaves their room and is unable to return and keeps wandering outside, it can be determined that the person being assessed is not capable of going out alone. Special circumstances: the assessment subject is a paraplegic patient who, although unable to go out independently, is in good mental condition. Based on the subject's cognitive and memory abilities regarding time, place, and people, the assessor determines that the subject is capable of going out independently and poses no risk of getting lost. The assessor may assign the subject a spatial orientation score of 4 and record this information in detail in the Special Matters record sheet. We now examine the third evaluative domain, person orientation assessment. It refers to the knowledge of people with whom one has lived for a long time, including relatives, caregivers, neighbors, and friends, with whom one frequently visits 3 or more times a week. This includes knowing the names of the people and knowing the relationship between the person and oneself. The main assessment methods are testing and interviews. This is the scoring criteria for person orientation ability. When assessing a person's orientation ability, the following polite phrases are commonly used by assessors. Grandpa, Grandma, do you know your own name? Do you know him, the person being assessed's family member or caregiver? What is your relationship with him? Grading criteria 1, 4 points. The subject of the assessment knows the person with whom he has lived for a long time, can correctly address the other person, and knows the relationship between the other person and himself. The main manifestations include: they can accurately answer their own name, recognize relatives, caregivers, neighbors, and friends who live with or do not live with them, and can correctly address them and know their relationship with them. 2. 3 points. The person being assessed knows most of the people they live with and can correctly address them or know their relationship with them. The main characteristics include being able to accurately answer one's own name, recognizing most of the family members living with the child, being able to correctly address them or knowing one's relationship with them, recognizing caregivers and at least one neighbor or friend with whom the child frequently visits, being able to correctly address them or knowing one's relationship with them. 3. 2 points. The person being assessed knows a small number of family members or caregivers who live with them daily and can correctly address them or know their relationship with them. The main manifestations include being able to accurately answer one's own name, recognizing a small number of family members or caregivers living with one, as well as neighbors and friends who frequently visit, and being able to correctly address them or know one's relationship with them. 4. 1 point. The person being assessed only knows himself or a very small number of family members or caregivers he lives with daily. The main manifestations include being able to accurately answer his own name, or knowing a very small number of family members, caregivers, and neighbors or friends he frequently visits, and being able to correctly address them or know his relationship with them. 0 points. The person being evaluated does not know anyone including himself. The main symptoms include being unable to accurately answer one's own name, being unable to properly address anyone or know their relationship to oneself. Assessment considerations. Assessors should inquire in detail about the subject's person orientation performance over the past week. If this performance differs from the subject's performance on the day of the assessment, the more frequently observed performance should be used to determine the subject's person orientation ability. Now we will examine an overview question requiring application of the assessment principles discussed in this chapter. Case 1. Grandma Liu is 63 years old. She cannot answer the year, month, day, and season corresponding to the assessment day, but she knows whether the assessment was conducted in the morning or afternoon. She can answer the name of her current city, but does not know the detailed address of her residence. She often cannot find her way home after going out. Case 2. Mr. Shan is 70 years old. When the assessor asked Mr. Shan about the date of the assessment, he replied that it was 3 days ago. Mr. Shan knows which neighborhood he lives in and often takes walks alone in the neighborhood, but he does not know the specific building number or room number. If you were an evaluator, how many points would you give Grandma Liu and Grandpa Shan for their time orientation and spatial orientation? This concludes the first part of our discussion on mental state assessment. Thank you for listening. This section is now finished. Thank you.